Lindsay, big changes are coming for Americans in 2014. President Obama's Affordable Care Act will provide health care to over 30 million uninsured citizens. But how will it work? We asked local medical professionals to break down the controversial law. Health care reform, Affordable Care Act, Obamacare. These terms are often used to describe President Obama's law that provides nationwide access to health care. But what is the Affordable Care Act, and what does it mean?
The Affordable Care Act came out and it requires everybody to have health insurance. And the estimates that the government has put out says that 32 million uninsured Americans will get health insurance. So if that's truly the case and what happens, I think that's a big plus.
But there's a price of getting health care access for millions of uninsured citizens.
If you don't have health insurance starting in 2014, you will pay a penalty. And that penalty will be $95 or 1% of your income. But in 2016, it can be as much as $695 or 2.5% of your income. One of the provisions is the expansion of Medicaid. And it would expand Medicaid to 135% of the poverty level. That is an option for the states. And our governor has very vehemently said that he will reject the Medicaid expansion. If you are below the federal poverty level and those insurance premiums would be more than 8% of your income, you're exempted.
It will also have an impact on both large and small businesses.
If a company has more than 50 full-time equivalents, then they are required to provide insurance or they can pay a penalty. If you have less than 50, you're not required to provide insurance, but you could get a tax credit if you do provide insurance for your employees.
The president's healthcare reform also branches out to progressive medical technologies of the future.
The hospitals are having to put so much money into information technology and into other technology that most of them wouldn't have had to do.
One of the new programs is a financial incentive for the implementation of electronic health records, also known as meaningful use. The government provides financial incentives for professionals demonstrating an updated system, from paper records to these electronic records for patients.
In 2015, if you're not on board with meaningful use, you'll actually be penalized, and they're looking right now at 1% per year of your Medicare receivables, and that should increase up to 3%. It may increase actually more than that if 75% of the clinicians are not doing meaningful use by that point.
Many local residents aren't happy with the controversial changes to medical care.
Now, I've got patients, probably more than most, who are completely uninsured, and they pay their bills and they are responsible, and they don't want to be told by anybody that they have to go out and buy health insurance.
And we're already having, to feel the pinch in a lot of areas. I mean, gas prices here, the food going up. So more health care, more having to pay out of our pocket for more stuff, and it's just, I don't think it's gonna get better.
Governor Rick Perry's decision to reject insurance exchange and the Medicaid expansion may hurt uninsured Texans. Texas recently ranks as the worst in the country for healthcare delivery by the Federal Agency for Healthcare Research and Quality. Lindsay, back to you.